Hey, I've been talking to a lot of people recently about their DXM addictions, and I've been seeing a lot of videos from people that are addicted to DXM, a lot of young people especially, and people from all across the world as well. It's a big problem in Europe, I know, and it's certainly a big problem here in the USA. I don't know exactly what it is. I guess it's just the availability of the drug that makes it so appealing. But I wanted to talk a little bit about some strategies for coping, how to get off of it, if that's what you want to do, and I would highly recommend it. A lot of people get really, really physically dependent on it. There's this idea that DXM somehow is not physically addictive or mentally addictive, and that it's a very safe drug. And it's definitely not true. There's nothing safe about raising your blood pressure up and raising your heart rate to 140 beats a minute. It's just not safe at all. Maybe if you survive, fine, that's safe. But if you have a stroke, it's not safe. It's not safe to be having a stroke or a seizure. And believe me, I know a lot of people that have succumbed to that, that have had strokes, seizures, things like that. I myself have been in that position, where I've had to go to the hospital from this shit. So, if you're not able to use this stuff wisely, whatever that means, it's definitely not using it every day or using it even probably once a week. It's dangerous stuff to get addicted to. It really is. So I want to just offer some of my advice on what to do, how to get off of this stuff. One thing with DXM that makes it so difficult, it gives the person a serogenic high. It acts on the serotonin receptors. It gives you a feeling of well-being and happiness. But it also is like an opioid. It may actually be literally an opioid. I think that it is. But if not, it acts as an opioid at least. So it has these properties like an opiate that make the body feel, lighter. Some people describe feelings of floating. They feel a lot of pleasure from it. And then, thirdly, you have the disassociative aspect of it. So it gives you a distance from reality. It's like wearing a shield. And it's like looking through a window, maybe, into the outside world. You separate yourself from everything. You take a step back. And if you're in a position where you're being abused, for example, a lot of people who use this drug, I found, have been abused, and they use it to make life seem less real. It's almost as if they're watching themselves on a movie screen, and that can be a very tempting thing for people that have an underlying issue and they want to escape. So the first and foremost thing regarding DXM abuse, obviously, is to try and clear up some of those issues with therapy, with self-work of any type that you can. And the first step to that is acknowledging it. You have to acknowledge that you have some sort of problem underlying your addiction. Of course, the addiction is a problem, but then you have another underlying problem beyond that really needs to be taken care of. Because you can break the addiction, but if you don't break the underlying problem that you have, you'll never be free. You'll never be truly free from that. Addiction, the word addiction is very interesting in Latin. The root addictus means bondsman. So someone who is addicted is someone who is serving out their time in slavery, basically, to a bondsman, their drug. And some psychiatrists have even suggested, or I guess psychoanalysts really have suggested, that addiction to drugs is almost like a way of self-punishment for something that has occurred earlier in life. And I don't know if that's exactly true or not, but it's an interesting thought. It's something to think about. If you are punishing yourself, or if you do have a lot of guilt inside yourself for something that you've done earlier on in your life, that you need to let go first before you can let go of the defense mechanism, which is the drug that you're abusing. And the same could be said of any drug, but I think DXM is particularly, or any dissociative is particularly powerful, potent for escapism, and putting that shield up. You know, if you're going to do this drug anyway, you don't want to die. You want to maintain your use in such a way that you can hope to rehabilitate yourself and get off of it without dying. And some people come off of it really quick, and you know that's not always good. You need to seek a health professional to decide for you what you need to do. And it's unfortunate that a lot of people don't understand about DXM as a drug. Most doctors, I think, still to this day don't really understand what it is, how it works. When I was in the emergency room several times, you know, they were starting to catch on. They had seen other people in the same situation as me. It is a spreading epidemic, particularly among our generation, the millennials, right? So, in order to not die, some things you need to avoid. Redosing. Do not redose. People have this idea that they can continue to just take it and take it and take it and wait and take it and wait and take it. It is a horrible, horrible idea, because DXM neurologically is not predictable, and when you dose twice or 3 times or 4 times or whatever, each time you're increasing your risk of something going wrong. And even just redosing once can cause stroke, seizure, death, whatever. I don't know the pharmacological actions that occur when you take a second dose, you know, an hour or so after taking the first one, but I can tell you that it's not always good, and it can be very, very damaging. I know it's very hard on your brain, so at least at minimum that should give you some pause. DXM also, I believe, is hard on the liver and the kidneys, usually because it's in capsule form or it's in a liquid gel type form, syrup, whatever you call it, and that's not conducive to good liver health or good kidney health, because all that stuff has to be broken down.